Hi friends, the small intestine is divided into duodenum, jejunum and ileum. The duodenum is the first, shortest, widest and most fixed part of the small intestine. So here you can see it extends the pylorus. Here we have the stomach, pylorus of the stomach to the duodenojejunal flexure. Duodenojejunal flexure. It is about 25 centimeter long. 25 centimeter long. A C-shaped structure. So here the C-shaped structure and the concavity of the C-shaped structure occupies the pancreas. Yeah, the pancreas. Okay, and it is divided into first part, second part, third part and fourth part. It lies opposite to L1, L2 and L3 vertebra, opposite to the bodies of L1, L2 and L3 vertebra. Okay, here we have the duodenum and the pancreas. The duodenum and the pancreas are most deeply located for the part of the viscera and which is least accessible for the physical examination. Okay, during physical examination we cannot palpate the duodenum and the pancreas. Okay, so here we have the first part or the superior part, then we have the descending part or second part, then there is a third part here, and here comes the fourth part. So today in this video we are going to see the detail of the second part of duodenum. The second part is 3-inch long and it is retroperitoneal. Okay, so the second part starts from the superior duodenal flexure. So the first part make a bend here and that is the superior duodenal flexure, and from the superior duodenal flexure it runs downwards on the right side of the body up to the lower border of the third lumbar vertebra, where it continues as the third part. Okay, remember the importance of the second part is the upper part of this particular second part of the duodenum grows from. Okay, so here this particular part develops from foregut and the lower half develops from the midgut. Okay, and here we have the colon and transverse colon. This particular second part of the duodenum lies behind the transverse mesocolon. And into the second part there opens the bile duct and the main and accessory pancreatic duct. Bile duct from the liver. So here we have the liver, bile duct from the liver, and at the concavity we have the pancreas. Okay, pancreas duct, major and minor pancreatic duct from the pancreas opens into the second part of duodenum. Another feature is it is the only part of the intestine which is supplied by double rows of vasa recta. That means, so here we have the duodenum, just see the duodenum here, and there is an artery here, we get the celiac trunk. Okay, from the celiac trunk there arises the pancreatico-duodenal artery. Okay, divides into anterior pancreatico-duodenal artery and posterior pancreatico-duodenal artery. Okay, on reaching the concavity, this pancreatico-duodenal artery gives branches to the second part of duodenum anteriorly, and also from the posterior pancreatico-duodenal artery it supplies the second part of duodenum posteriorly. Okay, so he gets a series of small arteries from the anterior pancreatico-duodenal artery on the anterior surface, and on to the posterior surface there is the posterior pancreatico-duodenal artery. Okay, that means it is only part of the intestine which is supplied by the double rows of vasa recta. Now let us see the relations of the second part. Okay, so here just look at this diagram. We are seeing the second part of duodenum. So here we have the liver, here comes a gallbladder, this is the ascending colon. Okay, what are the anterior relations? Anteriorly we have the gallbladder, then we have the right lobe of the liver, then there is a transverse colon, and again we have the transverse mesocolon and the coils of small intestine. So these are the structures related anterior to the second part of duodenum. Okay, what are they? Let us see one by one. Once again, we have the gallbladder, then we have the liver, then there is the transverse colon along with the transverse mesocolon and the coils of small intestine. Okay, so in this diagram you are seeing the posterior lesions. Okay, so behind the second part of duodenum we have the right kidney, then we have the right renal vessels are there, right venal vessels, then the right edge of inferior vena cava. Okay, then we have the right psoas major muscle. Okay, so these are the structures on the posteriorly. Once again, we have the right kidney, then comes the right renal vessels, then the right edge of the inferior vena cava and the right psoas major muscle. Now see, let us see the medial relation. What are the structures related medially? So this is the second part of duodenum. So medially we have the head of the pancreas. Medially we have the head of the pancreas. Laterally, okay, from below upwards we have the ascending colon. Okay, ascending colon, then we have the right colic flexure, then the right lobe of the liver. So here we have the right lobe of the liver. On the right side we have ascending colon, right colic flexure and the right lobe of the liver. Okay, and remember the second part of duodenum sometimes is compressed by the annular pancreas. Normally the pancreas is present is inside the concavity of the duodenum. Sometimes what happens actually, so here we have the duodenum and the pancreas makes a loop around the second part. Okay, you can see here pancreas encircles the second part of duodenum. So this is now like this is the lumen of the pancreas. Okay, so that condition is known as the annular pancreas. Annular pancreas. Okay, annular pancreas. Again, if there is CA of the head of the pancreas, if the head of the pancreas, if there is a carcinoma, so this carcinoma of the head of the pancreas and this annular pancreas may compress the second part of the duodenum. Now I already told you the second part of duodenum. Here we have the first part of duodenum, second part of duodenum. Second part, upper half develops from the foregut and the lower part from the midgut. And the central portion, I told you there are two structures are opening. One is the bile duct from the liver, another is the pancreatic duct. Okay, so here you can see the bile duct. Okay, so here we have the bile duct is opening. Another opening you can see that the major and minor pancreatic ducts opening. Okay, there are two openings you can see, and the two structures are can be seen inside the second part of duodenum. One is the major duodenal papilla, another one is the minor duodenal papilla. Okay, so here we have the major duodenal papilla and here is the minor duodenal papillae. Now, what is major duodenal papilla? This major duodenal papilla is also known as the papilla of water. What exactly? So here we have the major duodenal papilla. So major duodenal papilla, it is nothing but the opening of hepatopancreatic duct, that is bile duct, and from major pancreatic duct, both opens here, that is known as the hepatopancreatic duct. Hepatopancreatic duct opens as the major duodenal papilla. Okay, so how will you define the major duodenal papilla? So major duodenal papilla is an elevation on the mucosa of the second part of the duodenum, which is present on the posteromedial wall of the second part of duodenum. Posteromedial wall of second part of duodenum to the right of L2, L3. Duodenum lies at L1. Here we have the L2 and here this is the L3. Okay, at the level of in between or the right part of L2 and L3 on the posteromedial wall of the second part of duodenum, you can see the major duodenal papilla. Major duodenal papilla, and it is about 7 to 10 centimeter from the pylorus. So here we have the stomach, stomach. Okay, so this is a pylorus. From here to here, it is about 7 to 10 centimeter long. 7 to 10 centimeter. Okay, it's also known as the ampulla. That particular mucosal fold is known as the ampulla of water. Ampulla of water. Okay, and this papilla may be hard to locate because of this mucosa. Inside the second, except the first part of duodenum, the mucosa of the duodenum has got circular mucosal folds are. So these circular mucosal folds are known as a plica circularis. Plica circularis. Okay, because of this plica circularis, this major duodenal papillae may be hard to locate. From this major duodenal papilla, there arises a longitudinal fold which goes downwards. Okay, so that longitudinal fold is known as the plica longitudinalis. Plica longitudinalis. Okay, and the opening of this particular major duodenal papilla frequently filled by villus like projections called valvules or valvulae. Okay, so in this area you may give some small mucosal projections called valvulae. Next one is called minor duodenal papillae. Okay, where you can see just above the major duodenal papillae, we have the minor duodenal papillae. Okay, minor duodenal papillae. What structure is opens into this minor duodenal papillae? That is the accessory pancreatic duct. Accessory pancreatic duct is also known as a duct of Santorini. Duct of Santorini opens into this minor duodenal papillae. It is all about 2 centimeter above this major duodenal papillae. Okay, and it is smaller when compared to this major duodenal papillae. Okay, remember how we can locate this minor duodenal papillae. Okay, so the minor duodenal papillae can be easily is located by looking at the gastroduodenal artery. Okay, and here one thing you should remember, this duct of Santorini, that is this minor duodenal papilla where we can see this accessory pancreatic duct. In some cases, in 10% of the individuals, there is only minor pancreatic duct, that is major pancreatic duct is absent in 10% of the cases. In that case, what happens? The whole pancreas is drained only by the minor pancreatic duct. Accidental ligation of this minor pancreatic duct along with the gastroduodenal artery. Okay, I told you gastroduodenal artery is present just behind this minor duodenal papillae or related to this area. Okay, accidental ligation of this minor pancreatic duct along with the gastroduodenal papillae causes catastrophic pancreatitis. That means in 10% of the cases, there is only minor pancreatic duct. That is, the whole pancreas is drained by the minor pancreatic duct. So if we ligate this one, there won't be the drainage of the pancreatic juice. Okay, and it leads to severe pancreatitis. That was the second part of duodenum. Hope you enjoyed the topic. If you find it useful, please like, share. Thank you.